All right, effective teams are characterized by trust, respect, and working toward the good of the goal. So in considering teamwork model in healthcare, an interdisciplinary approach should be applied. And we talked about that. So barriers to fostering a collaborative team environment. So you need additional time. People think it takes additional time. There's perceived loss of autonomy, lack of confidence or trust in decisions of others, clashing perceptions, territorialism, lack of awareness of education, knowledge, and skills held by colleagues from other disciplines. And people don't know how much we know in nursing about leadership. I'm getting my doctorate right now, and there's a lot of reasons behind it, but a driving force is I am in a leadership position at the health department, and I only have my master's, only, quote unquote. But I know a lot about QI, I know a lot about patient-centered medical home, but a lot of times my decisions are or my ideas are secondary, or I need to prove more because people don't truly understand my role. And that's fine, right? I mean, it's just my job to teach them about what we learn in nursing school. And, with your BSN, you know about quality improvement, you know about leadership, and you have a voice and a place to say those things. So do any of these hurdles ring a bell in your organization? Most of them can be overcome with an open attitude, feelings of mutual respect and trust, and really just teaching people about what you can do as a nurse. So let's talk about role clarity. You want to create a knowledge-based, patient-centered approach to care delivery. Okay, so let's explore what we can do as nurses, and let's teach people that. When you're looking at tasks at hand to complete anything in healthcare, understanding the roles of those that are going to help complete the task is so important. A lot of times you can delegate or assign tasks in a different way than you thought before. It's essential to trust and to provide effective delegation, therefore utilizing the team members to their highest quality. You want to improve documentation, interdisciplinary communication, sharpen critical thinking skills, maximize user resources through awareness, and establish a rational framework for delegation decisions that maximize skill mix. Increase appreciation for the complexity of clinical care and create a platform to engage the staff in implementing unit-specific response to organizational initiatives. What a wonderful, a wonderful concept of role clarity to build teams. So understanding between healthcare workers. So a powerful incentive for greater teamwork among professionals is created by directing attention to the areas where changes are likely to result in measurable improvement for the patients they serve together, rather than concentrating in what on the surface seem to be irreconcilable professional differences. The fact is that most healthcare professionals have at least one thing in common. A person's desire to learn, and that they have at least one shared value, and that's to meet the need of the patient. So it's key to understand that the patient is the center of each person's heart, meaning each person is trying to do what is right based on how they were taught. So a successful teamwork model uses open communication, non-punitive environment, clear direction, clear and known roles and tasks for team members, respectful atmosphere, shared responsibility for team success, and appropriate balance of member participation for the task at hand. Acknowledgement and processing of conflict, clear specification regarding authority and accountability, clear and known decision-making procedures, and regular and routine communication and information sharing. Enabling environment, including access to need, resources, and mechanism to evaluate outcomes and adjust accordingly.